There's a free test that you can do at home in just a few minutes that can predict your risk of dementia and heart trouble and falls. You know that head rush that you sometimes get if you stand up too fast? Well, that's a mild version of what this test is looking for. So the test itself is easy. You rest lying down for a few minutes, and then you take your blood pressure, and then stand and take it again at 1 minute and then at 3 minutes. And if the top number falls about 20 points or the bottom about 10, that's a positive test, and it's called orthostatic hypotension. And you want to do this test when you're rested and hydrated, and if it's borderline, you just repeat it another day. But that number isn't really the point. A consistent drop on this test is really a window into how well your body runs itself. In a 2024 review, people with it had higher rates of dementia and cognitive decline, plus they also had more falls and heart disease and even earlier death. And for some people, it could be 3 major things that are driving this, but they're all fixable. First is the blood volume, how much fluid is in the system to work with. And the quick fix there is just hydration, but the lasting fix is the surprising one. Your body can actually expand its own blood supply. Give it a couple of weeks of steady endurance training, and your plasma volume can climb as much as 10 to 15%, so the tank itself gets bigger, not just topped off. And second relates to your leg muscles, the pump. When you stand, your calves and thighs and glutes are supposed to squeeze blood back up to your heart. And weak legs mean weak pump and more pulling. That's why calf raises and squats show up in almost every clinical protocol. Stronger legs mean less blood stranded below your waist. And third is the reflex itself. That sensor that triggers the clamp down when you stand up gets sharper with regular aerobic training. So you're not just refilling the tank, you're tuning the sensor that controls it. But there is one important catch here. If standing or walking already makes you dizzy, don't just go on a run because that can backfire. You want to start in a position that you tolerate. So things like a recumbent bike or rowing, or work up to standing exercises as you improve. That's how the rehab protocols are usually built. And another thing worth checking is you want to review your medications with your doctor, since there's so many medications that can cause this. Blood pressure pills and water pills, antidepressants, and prostate and hair loss drugs can all exaggerate that drop in blood pressure. And of course, this home test is just a screen, so if it's positive, definitely have it checked out with your doctor to find out the underlying cause, because that will determine the treatment and rule out any other issues which may be different from just basic deconditioning or low muscle.